Your comfort and relaxation is our highest priority. Man, imagine hearing those words softly spoken to you right at the end of a totally exhausting day. Instantly, this massive wave of relief just washes over you, right? You're safe, you're taken care of, there's literally nowhere else you need to be. Welcome to The Explainer. Today, we're diving into Journey into Calm, the science of ASMR and sleep triggers. We are doing something really fascinating today. We're going to completely deconstruct a simulated medical roleplay, specifically one of those soft-spoken ASMR cranial nerve exams. Now, if you've ever found yourself completely zoned out, totally relaxed, or maybe even falling asleep while someone is just quietly whispering or doing a really meticulous task, well, you've already experienced the power of these sensory triggers firsthand. So let's unpack the exact mechanics of how layering these specific cues actually induces that state of profound, deep rest. How can simulated medical tests, whispering, and typing sounds put you into a state of deep sleep? It's a pretty wild question, isn't it? Like, how does a totally imaginary exam, complete with whispered words and the clicking of a keyboard, manage to put your highly active, stressed-out brain into deep sleep? Well, as we're about to see, it's definitely not magic. It's a meticulously structured layering process. Every single whisper, every tap on a keyboard, every simulated touch, it's all a calculated tool designed to essentially hack your nervous system and quiet your mind. Okay. Let's dive into Section 1, Establishing Patient Comfort, setting the foundation for relaxation. So before any real relaxation can happen, your nervous system absolutely has to feel safe. And notice how brilliantly these seemingly mundane steps are designed to create that exact feeling. The very first thing the doctor does is confirm familiarity by saying, "I remember your face," and acknowledging that you're right on time. This instantly removes any of that low-level anxiety about being in a new place or messing up. Then they suggest using the nice, soft part of the hand to cover your eyes. The doctor even wears gloves. And why is that? It's to prevent that sudden, sometimes jarring sensation of unexpected skin-to-skin contact. You're even given explicit permission to just keep your eyes closed. So every single physical step here establishes a super secure, predictable boundary without setting off any internal alarms. All right, moving right along to Section 2, Visuals for Deep Calm, Muting the World. This muting concept is brilliantly illustrated by the light sensitivity test. The doctor tells the patient, "I'm going to use a light that is very, very bright, so it's important you keep your eyes closed." I mean, think about that. Instead of forcing you to strain your eyes staring at some harsh light, you're asked to track the movement and brightness through your closed eyelids. You're still participating, sure, but you are physically forced to maintain a posture of total relaxation just by keeping those eyes shut. And as this visual test continues, the patient is asked to count the flashes of light passing over their closed eyes. First, they count 5 flashes, then 11, and finally 16 flashes. The really crucial point here is that counting these gentle pulses of light acts as this perfect mental anchor. If your mind was, wandering off to the stress of your day or tomorrow's massive to-do list, this simple, incredibly low-stakes task of counting to 16 gently tethers your focus right back to the present moment. It's just a really effortless distraction from your own racing thoughts. Which brings us to Section 3, Auditory Triggers for Sleep, the Symphony of ASMR. Now, auditory triggers are arguably the most recognized mechanics of ASMR. Notice the deliberate contrast they use in this auditory test. On one side, we have that soft, human element, whispered words. But actually, not just any words. These are highly textured, plosive words, like squish, coconut, and buttermilk. Those hard C's and K's, the soft sh sounds, they literally create a physical tingling sensation. But then you contrast that with the clinical, resonant, almost metallic frequencies of the tuning forks, alternating between high and low pitches. This contrast engages totally different parts of your auditory processing. It keeps your brain just interested enough to stay awake, but relaxed enough to start drifting off. Then, the doctor plays recordings directly into the patient's headphones. And what's really fascinating here is the specific selection of sounds. We're talking water pouring like a river, the rhythmic clicking of keyboard typing, a gentle birdsong, and that crisp sound of a paper page turning. These aren't just random noises, right? They are basically modern lullabies. They're familiar, everyday sounds with a really steady, predictable rhythm. They signal to our ancient brains that the environment is totally normal, peaceful, and above all, safe. And this leads us to an incredibly effective technique called the Dichotic Listening test. So here's how it works. A spoken sentence is played in one ear, while completely different, distracting sounds are played in the other. For example, your left ear might hear the phrase, "Your optimistic eyes seem like paradise," while your right ear just hears a wash of background noise. The actual effort it takes to isolate that single comforting sentence from the surrounding distraction deeply engages your focus. It literally consumes all your mental bandwidth, leaving absolutely zero room for stressful or intrusive thoughts to creep in.
Let's look at Section 4, Grounding Through Gentle Touch, Physical Anchoring.
So how exactly do we physically anchor a patient? Well, the doctor introduces a sensation test using a specific tool. On one end, it's fluffy and soft, but on the other, it's pointed and sharp, or as the doctor usually reassures, more pointed than sharp. The patient keeps their eyes closed and just has to identify whether the touch on their face is fluffy and soft or pointed and sharp. This is brilliant because it forces the brain away from any abstract, anxious thoughts and pulls it directly into immediate, physical, bodily awareness. I mean, you can't be lost in yesterday's worries when you are hyper-focused on the exact feeling currently on your left cheek. This physical anchoring continues with the doctor gently touching and pressing down around very specific pressure points across the face. We're talking the eyes, the temple area, the brow bone, the cheekbones, and the nose. And remember, the doctor is wearing gloves here to keep the whole sensation very smooth and clinical. This rhythmic, light pressure across the exact areas where we tend to hold immense tension just perfectly reinforces that ongoing theme of safety and physical release.
All right, almost done. Section 5, Sense, Tastes, and Relaxation, the final senses.
To complete this full sensory shutdown, the doctor maps out some very specific scents and tastes. For smell, the patient is asked to identify sprays of coffee, peppermint, bright lemon citrus, and soothing vanilla. And for taste, they get drops of essence hitting the 4 major flavor groups: salty, spicy, sour, and sweet. Now, you might be wondering, why does this actually matter for sleep? Well, because by successfully identifying these distinct smells and tastes, the patient gets confirmation that their sensory system is perfectly healthy. There is absolutely nothing wrong. The body is functioning exactly as it should, which finally allows the mind to just fully let go.
And that brings us to Section 6, the ultimate nervous system reset, permission to rest.
This is the ultimate realization of the exam's true underlying purpose. At the very end of this meticulous examination, the doctor delivers a vital conclusion. Based on the exam that I've run, I can see that your nervous system and your mind are operating very, very well. This final diagnosis is the ultimate signal of safety. The patient is told they can just remain there, eyes closed, resting for literally as long as they need. It is this absolute authoritative permission to drift off, completely free of any guilt or worry. If simulated sounds and imaginary scents can trick our brains into deep sleep, what other virtual tools could we use to heal our real-world stress? That question really illustrates the immense power of this type of structured relaxation. If simulated sounds, like the simple tapping of a keyboard, and imaginary scents in a virtual role-play can effectively trick our brains into a state of deep, restorative sleep, what else is possible? Our brains are incredibly receptive to the right signals of safety and care, no matter where they actually come from. Thank you so much for joining me for this explainer, and I really hope you take a little piece of that calm with you today.